You know, we're spending a lot of time here on shouted accusations, on heated arguments, and the ridiculous rumors surrounding the health care reform debate. But millions of Americans have valid questions about how reform would improve the medical care they get. So let's get real. Roger Bentley is a self-employed husband and a father, lives here in Manhattan. I know that you follow these details closely because once in a while you jump in the fray on my Facebook page or whatever. You're glued to these town halls to get details. Give me the setup of your situation with health care.
Well, 2 years ago, I was let go from my previous job where I was executive credit director at Gray Advertising in San Francisco, and went about starting my own agency here in New York City. And right at the point where the market started to turn, I realized that COBRA was good for me at the time. We were able to afford that on a monthly basis, my wife and I, and my 6-year-old son, Owen. Hi, Owen. And then when the market really started to tank, my clients also started to tank, and people pulled back, and I haven't been able to make any money for quite some time now. So we ended up losing COBRA because we just couldn't afford it any longer.
People are telling me on COBRA, folks who have been in a position to need it, that it's absolutely unaffordable. Part of the reason it's unaffordable is because you don't have an employer anymore picking up the majority of the tab. So what did you go online to research other options? Because I've said before, we already have an exchange of health insurance. It's called the internet, and you can go on and find, hundreds of different plans.
Sure. And the first thing that you notice is that you immediately are inundated by a number of different offers. It's almost like you spend as much time getting rid of the crazy offers as you would just looking for something to research that would be affordable. And the problem is that for us, one of my family members has a pre-existing condition. So we are almost precluded from almost any plan out there. And if we do find an opportunity for something, it becomes so cost prohibitive that we can't handle it.
So now, you, your wife, and Owen, none of you have health insurance?
No.
And again, I want to point out, you're a very successful professional. At some points in your life, everybody else in America would probably have considered you wealthy, and now all of a sudden you're in the same boat with people from Mississippi to Wisconsin and to Manhattan. That being said, are there ideas that you're hearing right now that appeal to you, that think, yes, if this was passed, it would help me and my family in a way that makes sense?
Well, absolutely. I think the first order of business is being able to have affordable health insurance, and I think that by affordable, that would be something under $1,000 for a family. For us right now, even if precluding the pre-existing condition, we would be at about $1,200 a month. And under COBRA, that just almost was not a doable thing for us. $1,200 a month, I would imagine, would break just about any family out there. So if we were looking at something in the neighborhood of $300 to $400, that's completely doable. And that's something that I think would be realistic. Also, to not have this stipulation of not being able to be insured because of pre-existing conditions is ridiculous.
I want to keep you here. I'm going to bring in Lori Robertson. She's the managing editor of factcheck.org. We want to get through some of the clutter that is surrounding this whole debate. When we're talking about pre-existing conditions, for Roger, that's a big deal. What role does that play when we're talking about the legislation currently being considered here, Lori?
Well, both the House and the Senate bills would call for pre-existing conditions to be covered. So that's one of the insurance industry regulations that those bills address.
All right. On Twitter, I'm getting some responses here as well. Number one, if a small business cancels employee insurance and plans to send them on a public plan, how is that keeping the insurance you like? And also, I'm getting one, what would make employers keep employees covered if there was a public option? Is anybody talking now about if there's a public option, what encourages employers to keep paying for their employees?
Sure. You know, the public option, the federal health plan, is a controversial part of the bills, and some small employers may decide to buy into it. As far as I understand it, they can't really cancel your insurance and send you onto the public plan. They would essentially buy into the public plan like they would buy into another insurance option. And there's some different versions of the House bill. Depending on how it's structured, it may be very affordable, much more affordable than private insurance, and very attractive to small businesses and individuals who would be eligible to buy into it. Another House version, not so much. It would be more on par with what private insurance would charge, so it may not be as attractive.
So let me bring in Roger. It's interesting because here you are self-employed. You could get to the point where your ad agency at some point employs other people. And your wife just started a small business. Are you concerned about the burden, the insurance burden on small businesses?
Well, no, because I think that it's always a matter of cost. And I've been in companies before where the insurance plan was changed because the company found a more affordable health plan somewhere. So it wasn't my choice that they did that. They just did that.
All right. Let me talk about one of the other big concerns that keeps coming up in these town halls, and it's about how much of a financial burden this places on children like your Owen or grandchildren. Let me play it.
We are in debt up to our eyeballs, and you all are doing nothing but putting more debt on us and our children, and it's got to stop.
Lori, true or false? More debt?
Well, yes. Right now, the president continues to say that he won't sign a bill unless it's paid for, but the major bills in the House and Senate right now are not paid for. The Congressional Budget Office says both would add hundreds of billions to the deficit over a decade.
And then we are hearing a lot from these people at town halls, and Roger, you know this, having watched all of these town halls at home. They're very concerned about the direction the country's headed, and here's how they're phrasing it. Let me play that.
I don't believe this is just about health care. It's not about TARP. It's not about left and right. This is about the systematic dismantling of this country. I don't want this country turning into Russia, turning into a socialized country.
The plans that are currently being debated right now, Lori, in Congress, do they look like the plans in Russia?
Well, you know, we actually haven't looked much at what Russian health care is because I've never really heard anyone speak to Russia being a model for us. But it is a type of government-run system where health care is free, everyone has it. And most of the criticism has been that we're headed toward Canada or Britain, which is somewhat similar. And none of the bills that are being debated now call for that. There's no, single payer is also what this is referred to, but none of the bills are calling for that.
So, Roger, given the fact that you care about making a profit, but you also care about providing health insurance for your family, what's your take on all of that?
Well, I think it's completely out of line because, first off, I did 10 years in the U.S. Navy, and I loved the health care that I received then. And I would love to have that back. If there was a way that I could re-up in the military and still be an advertising guy, I would do that. I think that the government has shown that they are very capable with things like Medicare and Medicaid, and certainly there are plenty of people who love that. So I think that it's something that would only benefit small businesses.
Roger, I appreciate you coming in. Lori, thank you for your time today.
Thank you.
Thank you.
Now